Dr. Michael Barnes here, board certified psychiatrist, founder of Mindful Medicine. Choosing ADHD medication, I want to challenge the typical approach that says that stimulants have to be the first line choice. Sometimes they are, sometimes they're not. At Mindful Medicine, we like to tailor treatment to the individual. So today I'm going to show you a little bit of my algorithm, my thinking when you're treating ADHD. So you decide that you have trouble focusing, concentrating, difficulty initiating tasks. Maybe you're easily distracted. Maybe you're the kind of person that's kind of hyper, always on the go, don't like waiting in line. Maybe you're a little impulsive, can get irritable. Maybe your mind moves quickly. Maybe you lose things very often. These are all kind of subtle hints that you could have ADHD. So once a professional diagnoses you with this, getting medications can be a game changer. So you do have a binary decision of stimulants and non-stimulants when you're treating ADHD. The difference is that the stimulants basically are a higher risk, higher reward type of medication. They are, quote, addictive, which means tolerance, but also they are uppers and can higher your blood pressure, so you have to be cognizant of that. In the stimulants category, I kind of break them down into three parts. And the first one being the Ritalin or the methylphenidate molecule. And in here, there are multiple variations of Ritalin. I'm just going to write Ritalin here, okay? And probably 10 or more that fit into this category. There's racemic mixtures. They took enantiomers or isomers of them and they made new ones. And the delivery of these medications keeps changing, whether it's longer acting or shorter acting. Focalin is a medication that comes to mind here. Concerta is one that would fit into this category. It was also the first group of medications that stimulant medications that were studied in ADHD, and also the one that probably has the most data in kids and adolescents. So that's kind of some points there. The second one is amphetamines, and this is what you would also known as Adderall. The way I look at this category is that it's the strongest, it's the most powerful. That may mean better, but it also may mean more problems. So this is the one also that's the most abusable, so you have to be careful on who you give it to. So that's the amphetamines, and again, it comes in all types of different dextro variations, long-acting variations that come with some nuanced differences. Now, this last one is one medication, lisdexamfetamine, yes, with an F, also known as Vyvanse. This is often kind of a favorite. It's more smooth, potentially long-acting, less of a crash. It also has an FDA approval for binge eating and may be less abusable because of the fact that it needs the GI tract to work. So kind of an interesting choice, but I'll say on a personal note that, when we prescribe this, it's usually more expensive, harder to get covered by insurance, and there's also supply chain issues with some of these medications, including this one. Now, if we go right into the non-stimulant category to kind of jump here, there's a few of them. Atomoxetine, also called Strattera, you may have heard of. Okay, viloxazine, also called Qelbree. And then there's guanfacine, clonidine, markers run, and Wellbutrin. Okay, which I'm going to throw in there kind of to round things out. Now, I'm going to start with these two. In my opinion, these two are a little bit better for the inattentive symptoms as opposed to the hyperactivity, and vice versa for these three. I think these three are a little bit better at the hyperactive symptoms like agitation, impulsivity, irritability, impulsivity, as opposed to the first two that may be a little bit better at inattentive, distractibility, initiation of tasks, what we call executive functioning, things like that. So atomoxetine Strattera could cause a high heart rate, but otherwise it tends to be in my opinion, a little bit of a lighter medication. Most people do need a higher dose to get going on that medication. Been around for a long time, easy to get covered by insurance. So all these things have to play into the decision for the patient. Viloxazine is interesting because it was used in Europe for many years for different things and then got approved here for ADHD in children, adolescents, and adults. And I've had some success giving that medication as well. And then guanfacine, which comes in an extended release. It comes in an immediate and an extended release. And the extended is called Intuniv, you may have heard of. All that is extended guanfacine. And these are medications that lower blood pressure through the brain. I always say any medication that went through the brain, psychiatrists have studied, so this is an example of that. And it turns out that it kind of tones down the brain and can help hyperactivity symptoms. I threw Wellbutrin in here just to kind of round it out. This is not the best treatment for ADHD, but if somebody has depression and because of their depression they're having trouble focusing, this can help with that, in my opinion.